about being a member of the Information Society? That's a difficult question because I didn't know we were in the Information Society.
All right, ladies and gentlemen, day 2 of our Oahu trip, but this is really the main reason we're here, and that is to do Mrs. Loughmiller's medical appointment here at the Queens Medical Center. So we have safely arrived here and are now going to find where we're going to, and this is actually the liver center, yeah? Yeah, we're going to the liver center to go to see this guy right here. Dr. Chuang Tran. Alright, so we're here at the liver center waiting for the first scan, and the process is we're going to get the scan and then wait for the results and then meet with Dr. Tran so he can review the scan, and then hopefully we can leave this part of the land. That's how I did there.
I'm just waiting to see if you can tell me I can eat a donut.
You can. And we do have some ideas of places we want to at least get to before we leave this island. And Mrs. Loughmiller obviously wants to get some donuts. But we're not leaving without sizzling tofu, right?
Just one donut.
And one donut. But there's a special kind of donut that we're going to get. Look at us. We're over here at Queens Medical Center talking about donuts.
Checking on my liver, and I want a donut.
And that's what brought us here, is those donuts. And
No.
so anyway, that's kind of the process right now. We're waiting right now. And I guess the reward will be sizzling tofu and donuts.
Donut.
Why you gotta swear?
Because I want a donut.
Oh. Alright, they just took her in. I wasn't ready with the camera, but she just went in behind that door. They're gonna do her scans and then bring her back out. So I'm waiting here patiently, and we'll see how things go and how things went after she gets out. How you doing? How was it?
They just punch you in your liver.
For real?
They just punch you.
I mean, we're documenting this, so we're gonna put them on blast. Did they treat you well or no? Like what?
No, the test is they punch your liver.
Is that what it is? Because they're trying to get up close to the liver.
Yeah. So they punch your liver.
Stop saying that. Alright, so the liver scanning is done. Obviously she got punched in the liver, which is what she's trying to explain here. And then we're gonna wait for the results. I do an update, you guys. Apparently her liver is hurting now because she got sucker punched in the liver. So if you guys ever come here, just be prepared for your liver to be in pain after being imaged by the liver center here, okay? I mean, she's over here complaining off camera that it hurts.
It just feels like
Don't do it to me. I don't
like
want.
that.
I'm supporting you over here. Don't do it to me.
I'll show you.
No, don't show. You know what? We're supposed to be social distancing. Yeah, I'm supposed to be sitting over here. You see this? We're supposed to be here. I was over there until you started punching me in the liver. Hey.
Hi. How are you? How you been?
Good.
Good? Okay. So I think, last time we kind of talked about your lab test a little bit. And I think you told me last time that you lost weight, yeah?
Yes. I'm
You lost like 25 pounds.
Right.
So that's really good. As you guys can tell, between the December test and then even the test on Friday, both of those are showing that your liver tests are completely normal. So that's really good.
Yeah.
And I think it's probably related to the weight loss. So congratulations on that. Okay. I know it's probably not easy. Yeah?
No, it's not.
So that aside, whenever someone has fatty liver, the next thing that we look for is, do they have cirrhosis, or has the liver been damaged enough that you're having what we call fibrosis or scar tissue. So this is the scan that they just did for you, and yours is 7.9, which is kind of, let's say, borderline. What that means is that you have a little bit of scar tissue in the liver. It's not bad enough to cause cirrhosis, but it's kind of like on the early end of the spectrum.
Can you reverse that?
Can. It is possible to reverse it. If you have cirrhosis, it won't be reversible.
So where am I at this point?
You're at 2.
This right here?
2.
Oh, 2 right
Yeah,
here.
that one, yeah.
Would you say if we continue doing what she's been doing, like the numbers will continue to drop?
Yeah, for sure. I think that's definitely the case. So if you continue to work on the weight, you know, you don't have to, I guess, it would be nice if you keep losing a little bit more, but I think at least keep it, you know, keep from gaining. Your body mass index is 26.5. Anything less than 25 is considered normal. We talked about how on the MRI it shows that you have a little nodule, in the liver. It's less than a centimeter, which is like very, very little. I'm not worried about it. It looks like, you know, from what they're seeing, that it's very benign, meaning that it's not cancer. But because we saw it, you know, we should repeat the scan again in about 6 months after, you know, the fact, just to make sure that it's not growing, it's not changing, and that we can kind of like figure out what to do. So I think those are the main things I wanted to talk about. You know, you don't have, or you're kind of borderline pre-diabetes, they're calling you. So I think the weight loss probably helped, but keep going with that. Don't get diabetes, because if you do, the fatty liver disease will get worse. So weight loss we talked about. Exercise-wise, I want you to try to exercise cardio, but it doesn't have to be, you know, a lot. It doesn't have to be strenuous. So as long as your heart rate is going, that actually improves the fat in the liver without, you know, it doesn't matter if you lose weight or not. So if you lose weight, that's great. But if you don't lose weight, the exercise still helps. Any other questions so far?
I guess the question would be, are there any red flags in anything that you've seen, blood test, scan?
Not really. I think overall I'm pretty happy with, you know, the fact that your liver tests are now normal. I'm happy with the scan. I mean, I would like it to be, you know, 0. It wasn't 0, but that's okay. We can fix it.
That's my goal.
In your diet, if you can try to reduce the carbs. One of the ones that help the most is the Mediterranean diet. So then they look into that, you know, why does it help? Mediterranean diet only has about 30% carbs. Everything else is, you know, meats, proteins, vegetables, fruits, whatever, right? It doesn't have a lot of like processed foods.
Yes.
So even their meats are, you know, fresher. They're not like canned stuff, you know, things like that. And so because of that, it doesn't have a lot of saturated fats. And so those 3 things are the key to why the Mediterranean diet works. Okay, I think we got everything. So I'll see you again sometime in May or June. Thanks for coming in. Yeah, no problem.
Dr. Chan, thank you so much.
No problem.
So I want to be clear, diet and exercise, right? That's the things that we got to work on. Thank you. All right, ladies and gentlemen, this is going to wrap up the visit here at the Queens Medical Center. So overall, good news, right, babe?
Yes.
And what do you take from this appointment?
Diet and exercise.
Diet and exercise, and we cannot encourage that enough. And as you guys can see, I don't want to say we, but she has changed the outcome of what it was in September. Was that right? September was bad news, and this is January good news. And that's really the thing that we changed the most, was diet and exercise. And significant diet change, I cannot say that enough, significant diet change. And obviously the exercise has been, you know, implemented. So the thing that we can tell you guys is diet and exercise can change your life. And that's what we're doing here, right? We want to extend our lives as far as we can. We don't want to celebrate her birthday at Queens Medical Center next year. Not the way we planned on celebrating a birthday.
Turning after the doctor. He doesn't want to push me in a wheelchair.
I will push you in a wheelchair, but yes, I'd rather not, right? Vice versa for both of us. So, you know, this journey once again is for us to document, and we want to send a special shout out to Dr. Tran for giving us good news, but biggest shout out to Mrs. Loughmiller for doing the work. Right? You did a wonderful job. So we've been quiet because we've been working our asses off every day to make a significant life change. And I want to tell you guys can do it too. So let Mrs. Loughmiller lead the way, right? Follow Mrs. Loughmiller's path, you guys. But we hope that by sharing this also encourages you and helps you, right? That is...
Also, don't take fatty liver
for granted. Don't minimize fatty liver.
Because it can cause a lot of problems.
All kinds of things. Google that, right? Fatty liver is the start. And like he said, right? Cirrhosis. Once you get cirrhosis of the liver, you're going to have a host of other issues. So don't minimize any health problems, right? Take it serious. Take your health serious. Diet, exercise. And once again, that is life with the Loughmillers. So stay tuned for more of our journey to come on Life with the Loughmillers.
How do I feel about being a member of the Information Society? That's a difficult question because I didn't know we were in the Information Society.